Transmissible spongiform encephalopathies, also known as prion diseases, are a group of rare degenerative brain disorders characterized by tiny holes that give the brain a spongy appearance. These holes can be seen when brain tissue is reviewed under a microscope. Research suggests that TSEs are caused by an abnormal version of a protein called a prion. The term prions refers to abnormal pathogenic agents that are transmissible and are able to induce abnormal folding of specific normal cellular proteins called prion proteins that are found most abundantly in the brain. These altered proteins destroy the nervous system tissue, such as the spinal cord and the brain. Prion proteins occur in both a normal form, which is a harmless protein found in the body cell, and in an infectious form, which causes disease. The harmless and infectious forms of the prion protein are nearly identical, but the infectious form takes on a different folded shape from the normal protein. The normal prion protein, which is designated as a PRPC, is a 35 kD membrane glycoprotein, which is water-soluble and protease sensible. Abnormal prions designated as PRPSC or PRPTSC result from a change in the folding pattern of PRPC, which makes it resistant to the action of proteases and causes it to precipitate as insoluble amyloid. This conversion results in neuronal degeneration and loss by an unknown mechanism. PRPC is encoded by the PRMP gene on chromosome 20. TSEs include Creutzfeldt-Jakob disease, GSS, fatal familial insomnia, and Kuru. The symptoms may vary, but they commonly include personality changes, psychiatric problems such as depression, lack of coordination, and/or an unsteady gait. Patients also may experience involuntary jerky movements, insomnia, confusion, or memory problems. In the later stages of the disease, patients may have severe mental impairment and lose the ability to move or speak. MRI often shows high signal intensity in the caudate nucleus and putamen bilaterally in T2 weighted images. Electroencephalography exhibits characteristic changes such as diffuse slowing and frontal rhythmic delta activity. CJD promotes refolding of native proteins into the diseased state. The number of misfolded proteins molecules will increase exponentially, and the process leads to a large quantity of insoluble prions in affected cells. This mass of misfolded proteins disrupts cell function and causes cell death. Intracytoplasmic vacuoles appear in neurons. As the disease progresses, vacuolization becomes more pronounced and the cortical neurophil develops a spongy appearance. Loss of synapses and mass neuronal death start to develop. TSCs tend to progress rapidly and usually culminate in death over the course of a few months to a few years. There is currently no treatment that can halt progression of any of the TSCs. Treatment is aimed at alleviating symptoms and making the patient as comfortable as possible. A clinical trial of a potential therapy for CDJ is expected to begin soon at the University of California at San Francisco.